situation relative à la COVID-19 s'aggrave sur la scène internationale, des mesures supplémentaires devraient être prises en considération. Je reconnais que si cette décision est prise, elle aura des répercussions sur les familles, les élèves, les écoles et toute la communauté. These measures should not extend to the operators, staff, or youth within the early learning and childcare facilities at this time. The current risk assessment indicates that the risk of children acquiring COVID-19 is very low, and the risk of them having serious disease outcomes is even lower. So that's very reassuring. This includes facilities that are operating within schools. So daycare should continue to monitor for the virus, asking parents if their child is unwell and if they have traveled in the last 14 days. Early learning and childcare facilities, operators and staff who have traveled internationally are asked to actively self-monitor for symptoms for 14 days after they have returned to Canada. And we can talk about self-monitoring and self-isolation again, because I do keep getting questions around that, so I'm happy to clarify that again. Operators can access information to guide them to implement appropriate measures within their facilities on our website at www.gnb.ca/coronavirus on our community preparedness page. Like our healthcare workers, the role of early learning and childcare providers is an essential one, and I want to recognize their contribution to ensuring that essential services can continue to provide to New Brunswickers. The outbreak of coronavirus disease can be stressful for people and communities. It is natural to feel stress, anxiety, grief, and worry during and after a stressful situation. I know in certain situations people will say, well, just calm down, stop being stressed, stop being anxious, but I don't think that's the most helpful approach. I think we have to hear those concerns, hear that the stress and try to address it where they're at. So there are things that you can do to support yourself and your family, and that is to connect with others. Share your concerns about how you're feeling with a friend or family member. Check in regularly with loved ones, especially those affected. Take breaks, so take some deep breaths, stretch or meditate, make time to unwind and remind yourself that strong feelings will fade. Try to do your activities that you normally enjoy. Maintain a sense of hope and positive thinking. Get plenty of sleep, exercise, and eat well, and provide calm and correct advice for your children, again, by accessing appropriate, evidence-based, credible sources of information, such as the Public Health Agency of Canada website, the COVID-19 GNB website. Take time to talk with your child about the COVID-19 outbreak. Answer questions and share facts in a way that your child can understand. Reassure your child that they're safe. Let them know that it's okay if they feel upset, and share with them how you deal with your own stress so that they can learn how to cope from you. Limit your child's exposure to media coverage of the event. Children may misinterpret what they hear, and they can be frightened about something they do not understand. So I need you to hear this, New Brunswick. I know that you were concerned, and I understand this fear. I really do. And people going out and stockpiling is unnecessary, and I feel like that is also driving some fear. So as a province, New Brunswickers, we are resilient, and I know this can feel overwhelming. And to ensure the health system can support the most vulnerable, I am asking you to only call 811 if you are exhibiting symptoms of coronavirus. And we talked about that yesterday, which could be a cough, a fever, and shortness of breath. If you have other concerns around COVID-19, there are other places to get information, and that would be the Public Health Agency of Canada's toll-free number, which is 1-833-784-4397. And refer to our website, as I said earlier, for the most up-to-date public health information. Thank you. Merci.
Laura?
You say you should, you're only suggesting that they close schools. Should they make that decision?
Right. So today the government has an all-party meeting that's meeting right after this, and so they will be making that decision.
So it could be as soon as like Monday we see schools closed.
Yes.
And why are you supporting that decision, if that decision was to be made?
Two reasons. One, again, the changing situation across the country and globally. So internationally, the types of things that we're seeing in terms of cases, and certain countries have better surveillance systems than others and things like that. So, and conversations with my counterparts across the country. So in Ontario, they're closing schools for 2 weeks after March break. So again, things are changing, and as an extra precaution, that is why I would support this.
Support it or suggest it?
Support.
Aujourd'hui, Monsieur Dominique Cardet, le ministre de l'Éducation et du Développement de la Petite Enfance, nous disait que les décisions viendraient de vous ultimement. Alors pourquoi c'est pas vous qui prenez la décision de fermer les écoles?
C'est parce que sous mes pouvoirs, sous le Public Health Act, c'est pas quelque chose que je peux faire.
Alors maintenant, pourquoi, je sais que vous avez répondu en anglais, mais pourquoi ça vous semble justifié de fermer les écoles et pour combien de temps?
Alors, il y a discussion avec tous mes collègues dans le pays sur ce sujet. Ça dit qu'il y a des risques au niveau international et aussi au Canada. On voulait juste vraiment prendre considération de ces risques et les choses qui changent rapidement, très rapidement.
Est-ce qu'il y a des nouveaux cas? Vous n'en avez pas mentionné, mais est-ce qu'il y a des nouveaux cas
Non.
soupçonnés, possibles, probables?
Non, mais ça ne veut pas dire qu'on n'aura pas d'autres. Alors, comme je crois que j'ai déjà dit que oui, on a un cas et je ne peux pas dire quand on va avoir une autre. C'est difficile à prévenir, mais je crois, oui, on va avoir d'autres cas.
S'il y en a en fin de semaine, allez-vous nous aviser?
Je ne sais pas à quel... Je crois que oui. Oui, OK, oui. Mais l'autre chose que je voulais dire aussi au niveau des cas au Nouveau-Brunswick, c'est quelque chose qu'on prépare pour depuis le mois de janvier avec tous les secteurs, nos partenaires. Alors, c'est quelque chose on se prépare pour et on veut diminuer l'impact et on veut protéger la santé de tous les Néo-Brunswickois.
Is there any strategy in place should somebody living in a shelter start to exhibit symptoms who would have trouble self-isolating in that environment?
Well, we have put out many documents around what organizations can do within their facilities. So that type of information is available for people to be able to make decisions about what to do. But my understanding would be the same as any other situation that they would within each organization have ways of dealing with that.
Obviously, it's pretty difficult in shelter environments a lot of the time where you're sleeping communally to begin self-isolating. Is public health taking any sort of role in helping shelters and guiding strategies to help with that process?
At this moment in time, again, we provide information for organizations to navigate through this at this moment in time.
Andrew, I just need a little recap, because this morning Dominic Carty said you were making the decision and the announcement about whether schools would be closed, and now you're saying this whole party committee will make the decision. Is that correct?
I can only speak to what's happening right now and what's happening after this press conference, and my understanding is there's a multi-party committee meeting and they're going to make the decision.
So you're not making the decision to close schools or keep schools open, they are?
So under the Public Health Act, that's not within my power.
Right, so that's a political decision, ultimately. They have the authority to make the decision.
The government, all committee party is making the decision.
Okay, all right. And on testing, we're starting to hear that there's going to be testing stations set up, one outside the exhibition in St. John, effective Monday. Can you talk to us about that? Are you setting up, are there going to be areas, testing sites set up across the province in the coming days?
So we've had multiple conversations with the RHAs around their plans around alternative care pathways, and I don't have all the details on that yet, so they're the ones finalizing those details.
So we would need to talk to the RHAs about that?
Yes.
There's a press conference at 5 o'clock in Miramichi about COVID-19. What's that about?
I don't have any information on that.
Kevin?
You've talked about not calling the 811 line if you don't have symptoms. Do you have any idea how many calls that line is getting, and have you added extra resources to that line?
Well, all I know is that the line is pretty much jam-packed. So again, by having some of the messaging right now around what the most appropriate use of that line is, it's around the symptoms, and if you have questions, then we're directing you to call the 1-800 number for PHAC.
Are you adding more people to that line?
I haven't had those discussions. Again, we have so many people working on this that those discussions are probably taking place, but I'm not personally the one that's been involved in them.
Shane?
So we've gotten a lot of reports of people who have not been able to get through that 811 line. People saying, the wait time has been incredible. We're talking multiple hours, and some who are just dumped into a system when their calls are dropped, they're not getting through. So have there been any changes made to the 811 system since it was implemented?
Again, this is a really fast evolving situation. So as we get new information and we have new messaging, we do provide it to the 811 staff, and with the call volumes increasing, again, we're doing our best right now to deal with that. And one of the things that we are trying to do to deal with it is the message that I'm giving you today is that people who have symptoms should call, and if you don't have symptoms, call this other number. So we're hoping to ease some of the pressure on the staff that way.
Okay, so we're also hearing questions on how severe should symptoms be presenting themselves before people are making those calls?
Well, again, right now we know that COVID-19, the majority of cases, I think, I can't remember the percentages now, but the majority of cases do have a cough. Many of them have a fever, and some have respiratory breathing problems. So those are the three main symptoms that we're talking about. Again, recognizing that it is flu season, and so, is your risk higher to have COVID-19 versus the flu? It's probably higher that you have the flu, but again, we want people to feel comfortable to have access to that information. So that's, again, why we have a unique, dedicated website for people to get access to information. And again, the 1-800 number or 1-877 number for PHAC should help with questions around COVID-19. And again, the symptoms, those questions, again, if we've diverted people to the PHAC number, then perhaps we will have, again, we are addressing that surge capacity. So we will hopefully be able to continue to address people's concerns in that area.
Michel?
Deux choses. La première, je reviens sur les écoles. On a eu des informations de gens qui sont à FHS, High School, ici à Fredericton. Les enseignants et les enseignantes ont demandé à des élèves d'apporter toutes leurs choses à la maison. Donc, il semble que ça soit dans l'air qu'il y a une décision de fermer les écoles lundi. Est-ce que c'est juste une question de formalité avant que ce soit officialisé?
Mais comme je vous avais dit, il y a une réunion après cette conférence avec tous les partis, alors pour faire cette décision.
La deuxième chose, c'est sûr, vous l'avez souligné en anglais tout à l'heure, mais vous avez vu cette frénésie dans les magasins, entre autres pour le papier de toilette. Peut-être, j'aimerais vous entendre là-dessus. Qu'est-ce que les gens devraient faire de façon à être sécuritaire, prendre les mesures qu'il faut, mais sans exagérer?
Oui. Alors, j'ai donné beaucoup d'informations en anglais au sujet de la santé mentale, l'anxiété, puis les choses les craintes, puis les inquiétudes que les gens ont. Clairement, c'est un effet de ces sentiments que les gens vont changer les décisions qu'ils font sur acheter plusieurs choses que peut-être ils n'ont pas besoin maintenant. Et pour adresser ça, on veut dire qu'encore, il y a des informations sur notre site web pour dire à les gens que, OK, si vous avez des inquiétudes, il y a des choses que vous pouvez faire pour améliorer la situation avec votre famille, etc. Alors, je vous dis que je comprends les craintes, je comprends les inquiétudes. C'est vraiment difficile de comprendre toutes les informations, toutes qu'on reçoit à chaque 24 heures ou moins, parce que le média social, etc., il y a tellement d'informations. C'est pour ça qu'on veut diriger les gens à les sources crédibles pour leurs informations. Et un de les avis qu'on donne, c'est peut-être les enfants vraiment devraient minimiser leur contact avec le média social pour éviter plus d'inquiétude, plus d'anxiété, etc. Alors même les adultes, si vous écoutez toutes les nouvelles, c'est difficile de ne pas avoir ces inquiétudes. Alors, il y a des choses concrètes qu'on peut faire pour minimiser ces sentiments. Mais ils sont vrais. Je vois ça.
Andrew, last question.
Can you, just back to the testing, can you walk me through how this is working? You know, where are the clinics going to be? What is the plan for more testing sites? Are you going to be looking for money from the federal government to help set up more testing sites? Like, just all that kind of stuff. I just don't think I understand yet where it's at.
So again, many conversations have been taking place with the RHAs around that, and they are the ones who are developing those plans. And my understanding is when they're ready to announce all those things, that's what they will do.
Okay, so it's up to them to announce it. It's not going to
yes.
come through you, right?
As far as I know.
Okay, all right, thank you.
Thanks.
Thank you, folks. Happy Friday.
Happy Friday.